Thanks a lot, and thanks a lot for inviting the Commission to attend this conference, which is very timely, and the topic is very interesting, and I hope I can say a bit about some of the references Alan made on what's happening to aging and how we are moving forward also in respect of social innovation. So I'm Peter Wintlev from DG Connect of the European Commission, who are running the ICT-related innovation research activities related to demographic change, but we work, of course, also with our colleagues in the research that are looking into the health aspect specifically. Also, when we talk about stimulating social innovation and ensuring social impact, so these are also two different coins. So I think Alan alluded to the fact we have not yet really measured a lot on the social impact side, while we are doing a lot on stimulating social innovation. So as I'll show you later, we are also working in a way how we can really provide some useful and straightforward metrics that allows us to actually express the actual value of those interventions in monetary or social terms, because we still run into problems once you want to scale these things and make them into a mainstream practice. We lack the basis for people to take those decisions, because they also, in many cases, have fundamental impacts on the way we design public services, the way we support individuals, etc. So that's been a big focus on the work we've been doing also in the Innovation Partnership to find meaningful ways of doing that. I will not go into detail just on the Commission side. I think Alan mentioned how aging fits. In fact, we still see demographic change increasingly as a mainstream policy element in a number of different policies that we are doing across the whole of the EU Commission, from the digital side to the health policy side to the long-term care strategy to an aging policy. We also have launched a Silver Economy initiative that looks at, say, how we can look at aging as a positive impact for society and economy also in the future, because, as you know, also macroeconomically, the fact that people consuming will get older has a major potential impact on the whole GDP as well. So we need also, for that reason, to keep people active and productive for as long as possible, apart from the social and individual side. So we are trying to work in this landscape, see how can we create these innovation environments that can stimulate uptake of innovation that comes from research and innovation, but needs to be brought into the mainstream policies and also consumer aspects as well. How can we get a more positive view on all the people themselves, to see themselves as responsible for these things, because we also think in Europe have a tendency to expect that somebody else will take care when things go wrong, and we need also to empower people to become themselves a player in our prevention, our health, and the future impacts that may have when we get older. We also do a lot of research. I'll not in this presentation go into the details, just to show that we have a range of different initiatives like Future Age. We have joint program initiative, More Years, Better Lives, focusing around demographic change. We have on diets, on Alzheimer's, that all have a very strong link to aging. We have in the Horizon Societal Challenge 1 a very large number of initiatives that deals with aging as a research topic, both from the health side and from the ICT side. We have a joint program with member states looking at translating ideas into the market through helping companies to bring products and services to the market that respond to the needs. We have now small and medium-sized measures. We have pilot projects. We have also the public health program, the European Social Fund's activities around aging. We have a new so-called knowledge innovation community around healthy living and active aging that are trying to stimulate entrepreneurship and designing new education and aspects that take into account the issues around aging. So we have a huge panorama of different initiatives, and then we have the European Partnership on Active and Healthy Aging. That is kind of umbrella. That's not a funding instrument. It's a framework where we try to define some priorities for bringing innovation into scalable deployment, and also creating these infrastructures that we need, like the metrics for measuring innovation. So the European Innovation Partnership, just for those of you that may not be aware of it, it was an initiative we launched 4 years ago to try to bring all the people around Europe that are involved in innovation around active and healthy aging, and try to create a framework where people could meet, because in this area a lot of innovation, for good reasons, is very, say, distributed. It happens at the regional, the local level, and we saw a big problem in how to actually bring that together so people could learn from each other, that we could, on the other side, make sure that things that really have worked well can be translated and spread out, so not everybody have to run large clinical trials to prove that interventions really are useful. But at the same time also looking how we can translate practices across Europe, because it's also very clear that it's not one single Europe when we talk about health and care systems. There are very big differences, so also we're trying to find ways of how can we effectively transfer practices that they can be adapted from one place to the other. We also look very much at the importance about the prevention and screening, early diagnosis aspect, coming back to the WHO diagram, what are the innovations that we can do there that can be scaled up, how can we deal better with care and cure, and how can we support independent living and active aging as well. And then we have the 6 specific areas that were selected as the prime areas where innovation could scale up if we provide support in terms of improving prescription, adherence to treatment, management of falls as a kind of key area where innovation can help to prevent incidents, functional decline and frailty as new focus areas that need to be focused much more on integrated care between merging social care, health care and informal care more effective together, solutions for keeping people independent for longer, and then age-friendly cities and environments, that's the wider environmental aspect. So this was a quite large agenda, and we're working on this now for a number of years with specific action groups developing practices, developing guidelines, and trying to now scale up solutions that really have proven that they really deliver added value. It was quite a large initiative because people could come in with any, source of own funding, so it's a quite large partnership that we have built around the cause that we did, and also it has been a very important input for also using the money in the framework program that we have tried to take input from the real needs and bring that back into the support for research and innovation. We also developed a concept called reference sites, where we developed a kind of a Michelin star scheme for regions or areas that are particularly good at innovating and giving them visibility and the stars according to how good they are, how much evidence they've produced about their innovation, and how willing they are to share their experience with others. And we're now working with that, for example, to translate experiences using the EU structural funds based on some of the practices that have come out of those regions. So also when we talk about social innovation, we think really in our definition of doing research, this is kind of embedded, so it's not something done as a separate thing. We try to see how we can embed the concept of social innovation into the way we do research innovation. So in Horizon 2020, our calls are challenge-based, so in fact the challenges by definition requires social innovation when the success is measured not in, say, technological development, but in proof of impact. And by doing that, you actually force the research to actually embed social innovation as part of the projects. And also we distinguish really about the quality of life and well-being aspects and the care efficiency aspects. So we want to measure both those aspects at the same time, so we can find the places where you can maximize the impact. We also really see ICT as an enabler, facilitator of social innovation. It enables people to get information, enables them to interact, so it's one of the tools that can be used to engage people more effectively in designing and implementing systems. In the measurement social impact side, I'd say this was a key area. We really saw a big gap, because for policy changes we really need to provide better ways of doing that. So we know social impact is difficult to measure in socioeconomic terms, so we need to find good ways of doing that in a cost-effective and simple way, and how to capture the cross-policy impact, because we know in the area of aging there are a lot of different policies, like social policy, health policies, employment policies, and today we don't have very good metrics to show the crossover impact when you invest in one area that impacts on the other one, and that's why some of the barriers that we create to scale up the innovation, and also, as I said, how to transfer proven practices in an efficient way. So we're doing something, not only us, we have the active aging index, which is one particular exercise to try to quantify and create an innovation framework where people can benchmark themselves against what are the targets and what are the metrics that you can use to show how far you're supporting active aging. We are building now a repository of innovation practices based on the work of the Innovation Partnership. So this will be launched at 9th of December at the Conference of Partners. We'll be happy to see how we could pick up the Innovate results. But those metric repositories is not just a list of figures, it's also indexed by, for example, outcomes. You can find practices based on the outcomes that you're looking for, because the outcomes are not the same across Europe. So some may look for efficiency of care system using less people for doing the same work, others may look for less hospitalization, etc. So we try to index, for example, finding practices by outcomes, by geography, by intervention, so you have a way of finding the practice that really work in your particular policy setting. We're also launching a scheme for, like Marie Curie, but for innovation, where people can stay 3 months in a hosting organization to learn about a practice, so you can actually effectively transfer it. And then we have launched a big exercise about metrics and tools for socioeconomic impact assessment, which I would invite all of you to look at. In fact, this also responds to Alan's question, how we make the link to the 2 healthy life years, because we are trying to have a, say, practical layer where we have identified a number of real, directly measurable outcomes that are practical and are also expressing the quality of life aspects, expressing the sustainability aspects of the care system, so which are the cost parameters that can be also localized. So in the model you can take a practice and you can localize it by putting in your own cost parameters, and then you can actually check what will be the implication of that practice in your setting. It can be used also when you start a research idea. You can use the tool to actually test whether it's really your idea actually fits in the right framework, where it's better than current practices, so you already at an early stage can test out things, and then you, as your data improves, you can actually get more and more precision on the impact that can come out. But it also has a theoretical model that through causal relationships of those indicators can simulate what is the healthy life year impact from a given set of parameters. So this is a tool we are now promoting to spread out. We want to use it for our research projects, so we can use the same indicators when you test a new research idea, that you have the same basic framework that we use to see if that idea is useful or not. So that makes it easier to make successful research projects being picked up, because you can understand what are the possible implications that they have. It's also interesting for industry to understand, for business model, for new products and services, for policies, to see what are the possible impacts across, say, health intervention to the social side. Or we had an example, for example, where in a region they reduced frailty by 1.5%, but through this tool you can then calculate what would that mean in terms of sustainability aspects of your care systems. And this is extremely important when you want to pick up that practice and implement it on a large scale. So this was just one of the things that we're doing and we are developing this tool further. So it's launched now, and we are now continuing to develop it. So concluding from this brief intervention, I hope to say that social innovation for us is a kind of a core concept, but we really have tried to embed it into the way we do our research and innovation initiatives. We fully embrace the idea, and also as you'll see, there are new initiatives being launched that pick up on this concept. We still see, of course, further work for improving this cross-policy metrics in a way that they are better and even better to use. And also we need really to translate this into policy outcomes and targets. So we're working now to see how we bring this into the mainstream health policies. And now, for example, there's been a new initiative in the Center about integrated care working group that is being set up with the member states to really mainstream integrated care as a new concept for redesigning the health and care systems, which is a clear outcome of the long-term care strategy from DG Employment that really embraces the same concepts as well. So with this short presentation, I'll finish. If anyone of you are interested in the calls, we're just launching a major call on the horizon. I didn't say too much about it today for timing reasons, but you can find more information on the links about that if someone you're interested in.